Guys, we finally made it to the last week in our lesson. So this week, the good thing is that you already read the chapter, so you don't have to worry about learning pretty much new content. It's pretty much all together with your abdomen. I didn't want to do both the pelvis and abdomen assignments together the same week because it would have been a lot. So I gave you the abdomen last week. This week I'm going to go over the pelvis, but you basically already read the material. We're just obviously going to go a little bit more in depth this week with regards to the pelvis. So the bony landmarks that we go over. Let's start with, so obviously the pelvis. The pelvis usually starts, if you're ever scanning a pelvic patient, you usually start around L1 and you want to go to about mid-thigh, which mid-thigh is mid-femur. So you're going to have your lumbar spine, and your lumbar spine has 5 vertebral bodies. Then after L5, you're going to have your sacrum, which is the 5 fused bodies, and finally your coccyx, the 4 fused vertebral bodies. Then you're going to have the pelvic region, which is like the pelvic brim. Here, this is this pelvic brim right here, which, the inner part is the pelvic brim, and the outer part are the iliac crests. So this is butterfly winged shaped part of your pelvis. The iliac crest is kind of like the giveaway, and it's the clear indication that you're in the pelvis. You can feel the iliac crest on your patients when they're lying flat. You have the anterosuperior iliac spine, so that's the front part of their iliac that you can feel. So some people, if they're very thin and they lay down, you're going to see those bones sticking out. That's the anterosuperior iliac spine sticking out. The antero-inferior iliac spine is just talking about more inferior in the iliac spine. And then there is the posterior superior iliac spine, which is basically the back part of that pelvic iliac crest where it juts out behind you. You have your pubic symphysis, which is actually, it's also known as your symphysis pubis. Either name is fine. And this is actually made out of cartilage. It's what keeps your pelvis together, and this cartilage actually stretches a little bit when a woman is giving birth. It's just fun facts I'm laying out there. Your obturator foramen is this hole here, right where your ischium is. That's what it's referencing. Your acetabulum. This structure is so important. You see it so often in radiation therapy. You talk about it a lot in radiation therapy, and very easy to distinguish in images, and it's going to be in your boards. So make sure you know where your acetabulum is. It is the articulation of your femoral head, so this is your femur here, the largest bone in your body, and where it articulates with your pelvis. That is your acetabulum. Let's see, what other structures do they go over? The greater trochanter is this part of your femur, if you think back in anatomy back in the day. And then this lesser trochanter is the one more medial. So the lateral part of your femur that sticks out, that's known as your greater trochanter. The medial side, a lot smaller, is your lesser trochanter. In this image, we have a male, so you see the base of the penis, and it is used as a reference point to know if the patient is straight. If you have a female patient, you'll see the commissure of the labia, which these are all structures that you can use to ensure that the pelvis is straight on your treatment table. You're going to use that laser, and you're going to make sure that if it's splitting through either the base of the penis or the commissure of the labia, then your patient is lying nice and straight on your table. All right. So lymphatics. We went over a few of these already when we talked about the abdomen, but the ones that I wanted to make sure I touched base on for the pelvis is, so your aorta goes down, through your descending aorta goes down your abdomen. Once it starts to reach the pelvis, which is at the level of L4, your aorta bifurcates. And all the lymph nodes that travel down your aorta, either pre-aortic or para-aortic, which are the abdominals that we mentioned last week, they continue. There are more lymph nodes that continue to follow the aorta all the way down as it bifurcates. So before it bifurcates, right at the bifurcation, so we could say right around L4, you're going to have your common iliac nodes. And then after it bifurcates, you're going to have two iliac nodes, which are the external and the internal. And it's really hard to appreciate the external and internal part of it in this image. So we're going to look at a lateral view. And in this lateral view, you see your para-aortic node. So this is your aorta, this is your spine. And as it bifurcates right here at about the level of L4, L5, you see it, the more anterior nodes are known as your external iliac nodes, and the more posterior nodes, still hugging your aorta, are known as your, or the external iliac artery and the external iliac vein and all those. So after your aorta bifurcates, you're going to have the nodes that follow those vessels, and you're going to have the internal iliac nodes that follow the internal vessels, which are more posterior. You're going to have your sacral nodes, which are sitting right by your sacrum. And finally, your obturator node, a little bit more anterior. And the most anterior, most superficial group of nodes are your inguinal nodes. Okay, so the big picture that you need to take from the lymphatics of the pelvis, your common iliac, or I should say your para-aortics, you keep going down. Once your aorta starts to bifurcate, you're going to see your common iliacs there. And after it bifurcates and it breaks into the external and internal vessels, you're going to have external and internal nodes that follow those vessels. The other point I wanted to mention was, so your common iliac nodes, like I said, at the level of L4, these help drain your bladder, your prostate, the cervix, and the vagina. So just like the abdominal lymph nodes help drain abdominal structures, the pelvic lymph nodes start draining the structures that are down deeper into the pelvis. The chain, so the common iliac, it moves laterally, it breaks up into the external and iliac nodes like we mentioned. The external iliacs drain the bladder, the prostate, cervix, testes, vagina, and ovaries. And the internals, which are also known as your hypogastric nodes, help drain the vagina, cervix, prostate, and urinary bladder. So it's pretty much all the same structures, but the location of these nodes are different. Finally, the inguinal nodes, like I said, the most superficial one, they are so superficial that you can actually treat them with electrons. So, good point to know. Similar to the internal mammary nodes that we discussed on the breast, they are so superficial that you can treat them with electrons. And then I wanted to show you different images in CT. So this one is from your book. These slices are all going from more superior in the body to more inferior in the body. So here you have the femoral head right here. This articulation here of the femoral head with your pelvis is known as your acetabulum, like we mentioned. This is your pubic symphysis, or symphysis pubis, as they have it on the book here. And then as you keep going down here, this is your femoral head. This is your greater trochanter, the GT there. This is your prostate, okay? And your rectum is back here. This is the more anterior part of the patient. This is obviously the most posterior part of the patient. This small structure back here is your coccyx. And finally, even more inferior in the body. So here, by this point, your coccyx, your entire spine is not even in the image anymore. And here you have your symphysis pubis, you have your ischium, and this is your femur. Okay. These are lateral views or sagittal views, I should say, of the female pelvis and the male pelvis. I wanted to show how the spine is here. This is your sacrum, and it goes down all the way to your coccyx. The female structure, you're going to see the uterus. We usually sit right above the bladder. So this one, this darker shade here is your bladder. This structure sitting right above it is the uterus. And this is actually what we call a vaginal marker. So it does get inserted into the patient's vagina. It helps show the trajectory of the vagina and show where the vagina ends, the cervix starts, and finally the uterus, where that connection is of basically vagina, cervix, and uterus. Without a vaginal marker, it is very hard to distinguish where one structure starts and the other one ends. In the male pelvis, this sagittal view helps you appreciate. So this is your pubic bone, the pubic symphysis bone. This big structure here is the bladder, very full bladder in this patient. this right here, sandwich right beneath or right inferior to the bladder, directly inferior to the bladder is the prostate, and directly posterior to the prostate is your rectum or the male rectum. And obviously this would be the penis. Finally, your book does kind of do an overview of everything in your body. It's no longer separating it by location. It just kind of groups it all together. I think these images are super helpful. I love that this image actually breaks up the different locations in your spine for important structures. So like your thyroid cartilage is about C4, C5. Cricoid cartilage is about level of C6. Anterior iliac crest is about L5. All of these we discussed during the class, and I think it's really important that you guys look at these images and you get familiar with them for your final. This one, which is about the lymphatics, is also very helpful. Your book does go over each one of these, and I think it's important that you go over it once again for the final. Just from what I look at, I remember these are the submental, these are the occipital, the retroauricular nodes. You can see right about, so it's hard to see in this lateral view, but right about here would be your carinal nodes, close to this area. You have your mesenteric, inferior and superior and inferior mesenteric. You have your para-aortics. This is where your aorta bifurcates. You're going to have your external and internal iliacs. Obviously, external iliacs more anterior, internal iliacs more posterior. And most anterior to anything are your inguinal nodes. Remember that. All right, and that's it. That's all we have. We made it. It has been an absolute pleasure, and thank you guys so much for going through this journey with me. Yeah, let's go get that final, and that's it. Anatomy will be done. Thank you so much.